Someone just has Africa in here.
What are you talking about? I'm freezing.
It is. I feel like throwing up again.
You've been vomiting since we got off the plane. I think you have P.6 and pyrexia.
I think I might have gastroenteritis. It's probably nothing. Don't worry about it.
Do you heard some girl getting like black fingers?
Ew, black fingers? That's probably like necrosis or
Probably.
something.
Yes.
Let's go check in on her. Hey. Hi Hannah, how are you feeling?
I can't feel my fingers. They feel numb.
That's weird. What's your medical family history?
My grandpa has hypotension and my aunt has hemophilia.
Yeah, your family has some history.
Well, it looks like you have subepidermal hemorrhages.
What is that?
It's bruising underneath the skin. I mean, if you like hit your fingers or something.
Why would I have that though?
Well, it could also be ecchymosis if you like bruise your face, if you like jam them in a door or something.
I don't remember. I was out partying with friends. I don't think it was out of hand.
What do you have, amnesia?
CNN breaking news. This is George Number. A widespread epidemic of proctitis has spread through the city. If you do indeed have it, please come see a proctologist at the College of Proctology and Rectoplasty to get a proctoscopy and be sure you don't have it. Again, if you are having rectalgia, please see help right away. The longer you wait, the higher chance of developing a macroproctoma or colorectal cancer. It will need a rectomy.
This is bad.
Oh my gosh! I'm taking you guys to the hospital. What is wrong with you guys?
Yeah, we got it covered.
Okay, you're both dehydrated. You've got to get intravenous fluids.
If you're severely dehydrated, you might have thrombosis.
Blood clotting. Oh, my body hurts.
You have myalgia. This is bad.
Your blood tests indicate low leukocyte counts.
Doctor, I'm having trouble breathing and my chest hurts.
Dyspnea and apnea. Any other symptoms? Horrible.
I don't know yet, but we'll let you know as soon as we do.
And how long will that take? How do you not know what's wrong with them? You're the doctor.
Action.
We are doing the best we can at this moment, ma'am. Sir, your nose is bleeding.
Okay.
And cut.
Sir, are you okay, sir? What's wrong with you? Blood coming out of your nose? I think you're having epistaxis. Are you okay, sir? Are you okay, sir? Emergency.
Doctors! Doctors!
What's wrong? Is that an emergency?
My throat hurts.
Are you kidding me? The button is supposed to be pushed for an emergency. You're not supposed to push it for anything else.
Well, she has lymphadenopathy. She has swollen lymph nodes.
Oh my god, I think the necrosis is spreading. Are you kidding me?
Are you going to have to amputate my hands?
Well, we'll have to examine it further.
Yeah.
Just,
I think
hang
it's
tight.
okay.
Hang tight. Yeah.
Okay.
What?
This is a 26-year-old white male in room 136.
He has a nosebleed, dyspnea, and angina.
Dyspnea could be a sign of bronchial stenosis. In the bathroom, he coughed blood and he has hemoptysis.
Low levels of white blood cells could be autoimmune or a viral infection.
He could have pulmonary carcinoma.
Is thyroid cancer a possibility, even though he doesn't have dysphagia?
Bronchitis would be more likely because of the coughing.
We have to be sure it's not eosinophilic granulomatosis with polyangiitis.
Church-Strauss syndrome? His difficulty breathing and blood vessel inflammation could damage his visceral organs.
Aspergillosis could be a possibility if he inhaled fungal spores. We have to be sure he hasn't developed thrombophilia, abnormal clots in his pulmonary veins.
He took chemotherapy before his trip, so maybe he's more susceptible to diseases.
I think he has tuberculosis. He has had sibilant rhonchi.
Wheezing? I'll go check on him.
Right. Let's take a tomography to verify that he does have tuberculosis.
Okay.
Okay.
One. Go.
Sir, you have tuberculosis.
What? How did I get that?
Your chemotherapy before the trip weakens your immune system.
We're going to put you on a 9-month antibiotic treatment program.
Some of the side effects include jaundice, hematuria, nausea, vomiting, or loss of appetite.
My name's Jordan, and I used to smoke. One day, my lungs hurt so bad that I had to go see a pulmonologist. They diagnosed me with bronchoalveolar carcinoma, or lung cancer. They also said I've had hypopnea and pneumosclerosis for years, which explains the bilateral pain and excess coughing. The doctors took a pneumograph and said the cancer has spread to my kidneys, and now I have renal carcinoma too. The doctors say I have 2 to 3 months to live.
My name's Jordan, and I used to smoke. One day, my lungs hurt so bad that I had to go see a pulmonologist. They diagnosed me with bronchoalveolar carcinoma, or lung cancer. They also said I've had hypopnea and pneumosclerosis for years, which explains the bilateral pain and excess coughing. The doctors took a pneumograph and said the cancer has spread to my kidneys, and now I have renal carcinoma too. The doctors say I have 2 to 3 months to live.
Okay, we have this patient. She's a 39-year-old female. She's in room 139.
Her symptoms include discoloration of skin, fever, and subepidermal hemorrhages, swollen lymph nodes, and a rash that appears to be bug bites.
Okay, but her malaise discomfort indicates a disease or infection.
Her hands could be a result of hematoma, which is a collection of blood in the tissue outside of a damaged vessel.
Okay, but thrombocytopenia could be a cause, but if the rash is bug bites and she doesn't have nosebleeds, it won't apply.
Well, we know acrocyanosis isn't a cause because her hands aren't cold, they're just black.
I think it could be frostbite because she wasn't exposed to extreme cold.
Necrotizing vasculitis could be a cause. Hardening blood vessels could die and become necrotic, causing the tissue to die.
Okay, her age could mean localized scleroderma, which could have damaged the cells in the walls of the small arteries.
Hyperviscosity syndrome could be the cause of the black fingers because of the lack of circulation.
Okay, arterial circulation could be a problem if blood clots are in the small vessels.
I don't think it's that, but if it is, she'll need an angioplasty.
If she's having circulation problems, she could have mitral valves collapse.
Her valves don't close properly?
Maybe when I listen with the stethoscope, it sounded like she might have arrhythmia.
Have you done any other tests?
Yes, we did an angiogram. It did not indicate any signs of arteriosclerosis.
Good. I think she has worse problems with her dying limbs.
Okay, these signs are very similar to the Yersinia pestis, which is the bacteria from the Black Plague.
The discoloration could be also from peripheral arterial disease.
No, the discoloration is in her hands, not the lower body.
This girl is plagued.
Doctor, my arm is black. It's all black.
Oh my god.
Yeah, you've been diagnosed with Black Plague, so
Yeah, we're gonna have to amputate your hand.
Look at it.
We don't know if you're gonna live or die.
yeah, but well, good luck though. Keep it up.
Keep it up. Look alive. See what you for me.
Hello, Hannah, how are you?
I'm doing good. How are you, Penelope?
I'm good, but what brings you to my office then?
Carcinoma is a widespread pathology. The fact that it can be lurking anywhere is terrifying.
Okay, but what can you tell me about certain traits, characteristics, and or symptoms?
It's a sort of connective tissue. In time may become a neoplastic tumor on the growth of a subcutaneous layer.
Okay, how many times have you had it checked out? I have a number one dermatologist that you can see. You should visit. I mean, what have you learned? Any other important info about it?
I've gone 2 times, but they said there's no signs of anything harmful. But I get sharp pains and it worries me.
Okay, I believe that you just need to keep up with basic checkups. Just make sure you pay attention to everything they say. They will let you know if there's any type of negative reaction or damage.
They showed me a myogram of the integumentary system of the electromagnetic radiation to show change in the future if needed. I just hope the lymphoma doesn't develop a metastasis growth, potentially becoming harmful in the future.
Yeah, but until then, I think you shouldn't worry about it. You should just live a healthy life. You're young, and you shouldn't worry about it now.
Okay, thank you, doctor.
You're welcome.
We have a white male, age 29, in one room 37.
The patient is experiencing hemorrhages across his body.
He's also experiencing nausea, vomiting, abdominal pain, sore throat, and cephalalgia.
The sore throat could be pharyngitis, inflammation of the pharynx.
He's also experiencing a septic meningitis, could be the cause of the headache.
We shouldn't rule out mononucleosis that causes sore throat.
We don't know what his sanitary conditions were. He could be carrying this typhoid fever bacteria in his gastrointestinal tract.
Since he's showing no signs of anemia, we can rule out malaria.
Are you sure? He could have developed partial immunity resulting in atopic infection.
I'm surprised he hasn't gone into hypothermic shock. All this blood loss is taking a toll on him.
We should consider Marburg virus. He's getting worse by the second.
If it is, we should make sure he hasn't developed pancreatitis. If he continues like this, he could develop neuropsychiatric symptoms.
He has Ebola!
Action.
Sir, we have discovered you have contracted the Ebola virus.
Doesn't that mean you have it too? It's extremely contagious and transmitted through direct contact.
He's right. That's the end of us.
I have a trivia for you guys. How many people can fit in a bathroom? Let's go. 1, 2, 3, 4, 5, 6, 7, and 8. Let's take the door.